Hello everyone and welcome back to my channel. So today I'm going to be talking about the differences between adult NHS inpatient mental health care and private adolescent inpatient mental health care. And before I get started, I know that there's a big difference. One's adolescent, one's adult, one's private, one's NHS. I know that. But I don't have the ability to compare accurately from my experiences anything else, because this is how I experienced my mental health treatment. I was only ever put in hospital at the age of 17. So obviously I was 17, and then when I turned 18, I was then put in adult ward. So I didn't ever experience an NHS adolescent ward. I am going to be inserting a few different clips because I did record this twice, and one of the times was really, really long, and it was like 17-18 minutes, and I was nowhere near finished, but it had more kind of story type based things. So if you see a bit of switching and everything, that's probably because I'm going from the two different clips and I'm putting in stories. So I've done a little list of a few things that I could think of that were the main differences between the hospitals. So I'm going to start off with the first three things I have on my adolescent list, and that was no phones, no caffeine, and no gum. So that was like the three things that really annoyed me. No phones, no caffeine, no gum. So when I was on the ward, literally, as soon as you entered that ward, one of the first questions they asked you was, do you have a phone, as in a mobile phone? And most teenagers would say, yeah, of course I have a mobile phone. They would say, well, you need to turn it off and hand it in. So that to me puzzled me, because I was like, well, how am I going to communicate with my mum, or how am I going to communicate with my friends? And she said, you can call your parents or anyone that's on your, notes. You weren't allowed just to call any random number. So even if you'd remembered your friend's mobile number, or you'd written down your friend's mobile number, you wouldn't be able to use the ward phone to contact them. Like, if I wanted to call my mum, I would go up to the office, I would say, can I call my mum? And they would say, okay, let me just get the phone, sit in the communal area, let me get the phone, I'll put the number in, and I'll bring it out just before I push the dial. So they would go in, they would open up your notes, and they would get the number. You couldn't stand there and tell them the number. Even if you were 16, 17 and you remembered the number, you literally just couldn't stand there and tell them, because for all they know, you could be giving them a completely false number that's for one of your friends. So they have to go and get it from your notes. So I was really lucky in one respect, because when they asked about my phone, I said to the lady who was doing my admission, I said, oh, can I have my phone for half an hour just so I can tell my friends where I am? And at that particular time, I was on Twitter and I was talking to a lot of people online, and not a lot of people, but like a few people that I wanted to know. I wanted them to not worry if I wasn't responding, because I was always really, really good at responding. So I drafted up a quick text and I sent it out to a few of the people, make sure it definitely delivered within Twitter, and just said, I'm being admitted to the adolescent ward now. I can't have my phone on me, so therefore I won't be able to respond as regularly as I usually am. And everyone was like, yeah, that's fine. Well, I didn't actually get to see all the responses, but everyone that was online and responded really quickly was like, yeah, that's fine. Whereas on the adult ward, you were allowed it. You were allowed to have your phone. You were allowed to have anything with caffeine in it, as long as you could get it. And that's the big thing. So if you could get it, and some people would send other patients out to go and get them, caffeine, and that's fine. And then gum as well, you were allowed gum. They didn't like it, but they couldn't really take it off you. They could ask you to make sure you put it in the bin, but they couldn't make you. That's one of the big things. So another one of the main big differences was in the adolescent ward, we went on either weekly or bi-weekly outings, and that was things that we actually would go in a minibus and we would go out. Whether that be just for a drive, and there was a couple of times where we'd literally just go for a drive and then we would get ice cream. That was the outing. Like, you know, it was just nice to get out. Like, there was a couple of times, I think we went to the cinema once, we went for a picnic, we did all these bits and pieces, and it was lovely. It was so nice, like, to get out of a ward. Whereas in the NHS adult ward, there was an activity schedule, but it was nowhere near as good. So you would either have like a craft afternoon, or you go to the gym for an hour, or something like that, which is good. Don't get me, yeah, they could make no effort. And sometimes there was days when there wasn't enough staff to run the activities. But if there was an activity schedule, and it was good. You know, the main difference in these hospitals obviously is the funding. Like, private hospitals get like money per night for you, whereas NHS, they get money per night, but it is considerably less. So, you know, they've got a limit as to what they can provide and what they can offer. So another one of the big things was, and this is where I'm going to get into a bit more of a technical talk about the different types of patients. So the main two different types, I think there's only really two different types, but you've got informal patients, which are patients who have agreed / have capacity to be on the ward. So whether you've agreed to be there and you've said, yep, I need to be here, and that's it, you've said, yeah, that's fine. And the other type of patient is a sectioned patient. So a sectioned patient is somebody who is deemed to either not have capacity to make decisions, or not have capacity to keep themselves safe, or is deemed as not having capacity and therefore is held on the ward. So if you'd like me to do a video on the two main types and my experience of the two main types, because I have been sectioned and I have been an informal patient, so I can talk about that if you'd like me to. So the main difference was, if you were an informal patient in this adolescent ward, even though technically you were allowed to go out, you weren't allowed to go out on your own because you were under 18. Whereas if you were an informal patient on the adult ward, of course you're over 18, so you can literally just say to the healthcare assistant, can I go out? And as long as they can check that you're informal, that's it. Like, literally, they will just write down what clothes you're wearing and you can go. Like, they don't need to check anything else. Like, they will literally just be like, okay, yeah, and they'll send you out and they'll let you go. Like, with the adult NHS, I've had a mixture of admissions. So the majority of my admissions to the adult mental health NHS hospital have been informal, but I think I've had 2 admissions that were under a section 2. And in case you didn't know, the section 2 is when you are kept up to 28 days on a Mental Health Act hold. So that means you can't leave, you can't do anything, because you're deemed as being so unwell that you need, and it's defined as admission for assessment. So in those up to 28 days, and the important factor is up to 28 days. So people mistake it with like having it being 28 days and you're there for 28 days and that's it. That's not the case. You can be put on a section 2 for up to 28 days and you can be taken off a week later. It really does depend on the progress you make and everything, basically. How well, if you get better within a week, then they can consider taking you off of it. A psychiatrist can hold you on the ward in order for them to make an assessment of you and your current mental state. They're basically saying you lack capacity, and capacity can be anything from memory to choices to anything. It can be, you know, when someone lacks capacity, it doesn't mean that they're not orientated with date and time. It doesn't mean that. It can do, but it doesn't always mean that. So when someone lacks capacity, it can literally mean there are risks to themselves or others. So a lot of the time when I've gone on a section 2, it's because I'm a risk to myself. So section patients for both hospitals I have found are pretty much the same. Because when you're sectioned, you are deemed as either not having capacity, not making your own decisions, you know, all those bits and pieces. There are a few different criteria of why someone would be sectioned. But because the baseline of everything is you need to be kept safe for your own safety, for other safety, whatever it be, you're not allowed out in both of them unless you have what's called Section 17 leave. So Section 17 leave is when a psychiatrist has deemed you safe enough to go out on certain conditions. So these conditions might be anything from you have to be accompanied, or you can only go out for a certain amount of time. And that'll be written up in your notes, and you'll have like a form that will say Section 17 leave, and sometimes it can be accompanied and a mixture of accompanied and unaccompanied. So it really does depend, but usually it will kind of be something like 30 minutes twice a day, and then it will say unaccompanied, and you can go out on your own for 30 minutes twice a day. And that doesn't mean you can take an hour. It means you have to have 30 minutes, you have to come back, and then you have to go out as like a separate time, if that makes sense. And I think you can just like go out for half an hour, you can come back, you can check back in with the nurses and say, well, I want to go straight back out, I want to have my other half an hour, but I have to come and check back in with you. So it would almost prevent you from being out for longer than half an hour. The last thing I wanted to just talk about in regards to the main differences was medication times. So this might not be the same for every hospital that's across the world and across England and whatever. But medication times that I had when I was on the adolescent ward was morning, night, and there was PRN. There might have been the odd patient that had a new medication, but there wasn't really many. Whereas NHS have a very, very structured medication regime. And obviously you won't get called if you don't have medication at that particular time. But it's morning, lunch, tea, night, and PRN. So there's quite a bit of medication within the adult hospital. And you only get called if you actually had medication and they needed to give you medication. So usually the nurse will go into the meds room, she or he will write down everyone who's got medication, and then they will give the list to a healthcare assistant or a student or somebody to go around and find all these patients and call them to the medication room, but also to keep an eye on how many people are waiting outside of the room, and sort of only have maybe 2 or 3 people waiting outside the room, because otherwise it just gets quite crowded all in one space. So that's generally what happens. And just to break down the whole PRN, I'm not entirely sure what it stands for. I'll try and find the definition of it, but as far as I'm aware, it's Latin, and the literal definition of PRN medication is as and when required. Even though it doesn't stand for that, it is Latin. I think it's a Latin word, PRN, and obviously it's like an abbreviation, but the actual full definition when you break it down is in Latin. But the essence of the meaning is as and when required. So it's medication that a patient can either ask for, or a nurse can say, I believe this patient needs this medication to help them calm down. And that will be written up as if, okay, this patient can have this medication up to 2 times a day or up to 3 times a day. And there has to be an hour in between each dose, for example. All right, so that's it for today's video. Thank you for watching, and I will see you in the next one.